We've got a clinical case. A 65-year-old man with alcohol-induced cirrhosis is being evaluated for liver transplant candidacy. His MELD, model for end-stage liver disease, score is 18. An additional assessment reveals significant muscle wasting, sarcopenia, and a poor score on a frailty assessment. He is able to walk only 200 meters on a 6-minute walk test. From a holistic perspective, which of the following factors is the strongest independent predictor of mortality in this patient beyond his standard liver function scores? Give me options. The presence of spider angiomas, a serum albumin level of 2.9, his degree of sarcopenia and pool functional status, a history of 2 episodes of hepatic encephalopathy. The correct answer is his degree of sarcopenia and poor functional status. This question asks the student to think beyond the standard lab-based MELD score and consider the whole patient. This is the essence of holistic approach. So his degree of sarcopenia and poor functional status. This is the correct answer. Why? In recent years, it has become overwhelmingly clear that sarcopenia, loss of muscle mass and function, and frailty are incredibly powerful, independent predictors of mortality in patients with cirrhosis. So the liver is the body's metabolic engine. In cirrhosis, the engine fails, leading to state of profound catabolism and malnutrition. Even if the patient is eating, the body begins to break down muscle for energy. We have got a vicious cycle. Weaker muscles lead to poor mobility and exercise capacity. This deconditioning worsening liver function and increases the risk of complications like infection and falls. A frail sarcopenic patient is much less likely to survive the stress of a major complication of the rigors of liver transplant surgery. Many studies have shown that for a given MELD score, the patient with a worse sarcopenia has a significantly high risk of death. So why other options are incorrect? The presence of spider angiomas, well, this is our classic physical sign of chronic liver disease. They are a marker of the underlying condition, but not a strong independent predictor of short-term mortality compared to functional status. A serum albumin level of 2.9. Low albumin is a very important marker of poor liver synthetic function and is a component of the older child-pugh score. However, it's already factored into the overall picture of the liver failure. Modern evidence shows the functional status sarcopenia and adds powerful predictive information on top of the standard lab values. And the history of 2 episodes of hepatic encephalopathy. Hepatic encephalopathy is a very serious complication, and it's also a component of child-pugh score. Like low albumin, it's a known marker of severe disease. However, many studies have demonstrated that sarcopenia is even stronger predictor of mortality, and it represents the final common pathway of systemic and metabolic collapse. So high-yield takeaway, survival in cirrhosis is not just about the numbers on a lab report like the MELD score. The holistic assessment of the patient's nutritional state, muscle mass, sarcopenia, and functional capacity, frailty is critically important. A weak, deconditioned patient will do poorly regardless of their liver scores. This is why nutritional support and physical therapy, pre-rehabilitation, and becoming cornerstones of modern cirrhosis care.